We are at the New York Assembly hearing on the Medicaid managed care prescription drug carbon implementation. And here we have Glenn Liebman from the New York State, the Mental Health Association of New York State. Glenn, would you talk about just a little bit what you're going to be testifying here today?
Sure. There were three areas that I'm really going to focus on, largely around recipient protection, consumer protections. I think what we want to see happening is that grandfathering is going on with the plans, and that was great that we heard from the Department of Health today that they want to continue the policy in perpetuity around grandfathering. The issue that we have is we want to see that in writing. We want some sort of directive to the health plans making clear that that's the expectation. Because right now, there is nothing specific in writing about that. So that's a big piece that we have. Another piece we have is we have to send out all kinds of information, provider information. You know, that the department talked about a mailing that they sent out to all 3 million people on Medicaid, all the 3 million people who are affected. But the reality is that, as one of the assembly members said, it was very confusing and people didn't understand it. And what we're saying is you got to send out more mailings, more information. You got to create a website so people really have a better understanding. These are people's lives, and you have to take it very seriously, and I'm sure the department does, but the best way to do that is to provide the kind of information that people really can comprehend and understand, and not some sort of convoluted piece that was very difficult for people to comprehend. The third thing is we want to see physician prevails in place. The physician, in consultation with the recipient of services, should have the final say as to what their medication is. Even if it's not in the existing formula, physician prevails should prevail over the existing, whatever is, if it's not in the formula or not, if the medication is not in the formula or not.
Thanks, Glenn. Have you, with any of the people you've worked with, they have problems with this new prescription drug coverage model?
Well, what we're hearing is, that a lot of people, because there's no set complaint line per se, what we're hearing sort of a lot of general issues that people have that don't rise to the level of an official complaint, but that people are very nervous about entering the system now because they're fearful of, they don't know the repercussions of what could take place, and they don't know that they're going to get their medication or not. So there's a general palpable fear from a lot of people in the community about that.
Okay. All right, thank you very much.
Sure.